It's James Steinhubel with TVU on the Community Channel, and today we have Marie LePan, Chief Executive Officer of the Robin Hood Association. How are you doing today?
I'm pretty good. Thank you, James.
Excellent. Thank you for coming. How are you guys doing? How's the office? How's the engagement with your clients going with COVID?
I think, like everybody else, we are experiencing challenges and unprecedented times. You keep hearing that kind of comment. It has been extremely impactful, busy, stressful. It has changed how we do business and how we provide supports.
Mm-hmm. Now, it's very much a family centered business. So, and many of your clients are living in other family homes or going to family homes. So everybody's felt that kind of stress, but everybody's been able to use their smartphones and their tabs and their laptops to communicate and keep community going. How's that been working for you guys?
It took us a little bit to get that off the ground. I think we've relied a lot on our staff to actually have those tools. It's not something as a not-for-profit that we provide people, but I would say the majority of our staff have smartphones, so we've got accessibility right away. Having the ability to some of our group homes or group living situations, we have installed laptops and tablets if we could. Donations have come in to do that, and again, some individuals had some of those kind of systems. So very quickly we started to look at how we could do things virtually and stay connected with people in not only our homes that we operate, but individuals that have gone home with their families to isolate have stayed connected with some of their program staff and peers throughout the organization.
Now, a lot of the distancing and all that, but also you're in a very high contact, close quarters,
Yeah.
Nonprofit, non-government organization, social service.
Mm-hmm.
So a lot of requirements, but you guys were running a pretty clean shop. Anything that they put to you that was new and that you required extra, and any of that you're going to carry forward?
Government doesn't provide anything extra and doesn't, there a lot of the directions that have come through government, not our community and social services as much, but through the healthcare, we've had to comply with and adjusted some of our standards and expectations through the public health orders. We've adapted. It's been purely the staff and I think our emergency operating team that we have that has really taken the direction that we needed to go. And we've taken a pretty aggressive approach when it comes to how we've been controlling, and it sounds bad, but control what you control has been our motto. We serve a population that's very vulnerable. People with developmental disabilities that may have medical, fragile, aging population very much is at risk. They are supported in traditionally models where staff are coming and going a lot in their lives throughout the day, throughout the time in their home. You can have up to 4 staff that do a shift in a residential home in one day. That's a lot of people coming and going and exposing you. So we have done a lot early on to limit visitors before the visitor standard came out, where there's a no visitor in homes like assisted living homes and nursing homes that have that kind of policy. We fall under that. We were doing that 3 weeks before the order came out. So in a lot of ways, I've been really proud about how we've systematically made adaptations to how we'll support people. And it hasn't always been because of a directive that came through. It just made sense. It was common sense. At the end of this, I want to come out of it and think we did too much and nobody was affected. And if our criticism at the end of the day is nobody died, nobody got sick, why did you take the extreme measures you did? That's the reason why. It's all about people that I'm responsible for that are vulnerable and don't have maybe the ability to understand social distancing, are challenged with their medical conditions. That's something that we didn't take lightly and have put in some pretty, some people may say extreme measures in terms of how we're supporting our population right now.
Mm-hmm. You know, I want to talk about, the geographic area that you service and, the different aspects of the service that you provide. But before that, I want to get a little bit of a context. You've been with Robin Hood Association for 31 years.
I have.
You're a Grant MacEwan grad.
Yeah.
Just give us a quick, starting from, and many Grant MacEwan students and many Grant MacEwan grads will be watching this, but from where you are now to Chief Executive Officer of the
Yeah.
Robin Hood Association, it's very impressive.
Thank you. Um, yeah, I did start with Grant MacEwan. I actually, if I do have a bit of a resume before Robin Hood, so have had experiences in this education system and with other organizations and not-for-profits across the Edmonton region. When I went to university, I had practicums like you typically do, at least back in the 80s. And Robin Hood was one of those placements that I had. And it was the most impactful one that I had when I was at Grant MacEwan. Wanted to go back. I think it was one that actually stretched me a little bit more than others. And I just valued the leadership that they had at the time. I still value the leadership. It's an organization that is very unique as a service provider across the province. We provide supports from birth right through to palliative care, death for individuals and families. We've got wraparound services, so we've got a fair bit of flexibility. We have had a very strong membership, family-driven organization. It started with families. Colonel Cormack, Eric Cormack, and Barbara Cormack were our founders, and had a child at the time in the early 60s with disabilities that did not have services any longer, and started the Robin Hood School. 10 years later, the organization itself was growing and it became a school. And at the time, they were starting residential services, one of the first group homes, I understand, in the province, group living with 6 young children with disabilities, pretty complex needs. They had a call out for house parents. It was a new model in the early 70s. And who they found at that time was Bev and Ed Rittiger, who became our CEO and leader for the next 43 years. So we're very unique in just a really strong core group of people, high values, ethics, do the right thing. Talked a little bit earlier with you about we're accountable for funds. We are efficient. We're high quality services. Our focus is always about the family and the individuals we support. And I've learned that from Ed over the 31 years. I had the privilege of actually working directly with him for the last 17. So it was, I've had a tremendous amount of ability to learn in the organization. I haven't been in positions that were stagnant, and we've constantly evolved and kept up with what has been expectations of societies and as families have changed. I started actually as an employment specialist with Robin Hood, thinking I'd stay for a year and go off and travel and do something else. But like many of us, I think once you're in the organization, you're hooked. It's a very passionate, family-focused kind of organization that it is my second family. And you just can't walk away from it. And we have got staff, tremendously long-term, passionate people that have been with the organization. Another managers that are in their 30 plus years, someone in their 40 years. I think they might surpass Ed's 43 years. We have a lot of long-term staff that this isn't about just doing a job. And I think during these times, it's been really evident that we've got people that have really committed and passion for the people they support, so they don't walk away. Working through COVID has been terrifying for a lot of people. Trying to get proper personal protective equipment, PPE, doing the training that our staff has had to require over the last few months. We were never in the world of learning how to don and doff PPE equipment and the standards and the level of healthcare that we're not healthcare providers. So our staff have been under tremendous pressure to get caught up with the training that's needed, the standards and the compliances that have been put into place, but all in a willingness to support the people that they support, because they've been around, they have relationships, and they're not walking away because it's easier to do. And that's something that I'm quite proud of with an organization like this.
Well, and it's based on the leadership too, right? And you've got a lot of wins
Mm-hmm.
of how you've done and how you've led your organization. It's very impressive.
Mm-hmm.
So I just wanted to give a little perspective of the scope. How far of a range do you guys service, and what kind of divisions are you operating?
Yeah, well, our communities are Sherwood Park. Mainly, we started in Sherwood Park, hence the Robin Hood School. Robin Hood Sherwood Forest, I think in the early 60s, was the reason why the families had named us. Our majority of our adult services, who are PDD funded individuals, are supported in Sherwood Park, Fort Saskatchewan, Strathcona County. Our children's services programs have a bit broader scope. We have early intervention programs, which are actually Alberta Health Support Services. So their scope of connecting with families with young children that under 6 years old spans from Lamont County right through to Leduc County. So we have early intervention staff that do have a broader scope of services, but primarily we're in Sherwood Park, Strathcona County, Fort Saskatchewan.
Now, and just going to pull up your website and just let me know when you can see it.
I can.
Okay, good. I did say one last drink of water.
I have allergies, so don't
okay.
freak out over. Yeah, you want me to stay behind the scenes because I cough all the time.
So you've got lots on the go here. You've got adult services. This is at robinhoodassoc.com. So Robin Hood, and then an abbreviation of association, so ASSOC.com.
Yeah.
And so you've got adult services, children's services, and employment opportunities. So you've got quite a good website, and then you've got your main partners. So how do businesses partner with you, and what do you look for?
You know, a number of years ago, we recognized that we're a very large organization, and it's something that businesses, I think, would want to partner with an organization that has almost 700 employees, has 700 families, individuals that are served. We have far-reaching capacity, everything from insurance needs to grocery shopping to pharmacy is things that we could leverage. So we recognized that a number of years ago and have gone actively into looking at how do you partner with organizations that have a social conscience, that give back to community, and that can provide us with the appropriate services and cost-effective products that we can get. So just over time, you start to build relationships with companies, whether you're right now, I mean, buying PPE supplies or, your landscaping and having those kind of business connections. So I think we actually started a number of years ago doing an RFP for a pharmacist and looked at how we can maybe leverage a preferred pharmacy and how they could give back to us. And in the end, it's changed names a few times, but Mint has been a company that has stepped up and exceeded our expectations. The delivery of services and supports that they provide our population has been tremendous. They're a smaller pharmacy here in Sherwood Park. They actually have delivered, we provide services and work with Alberta Health Services with some professionals doing clinics, health clinics for psychiatric and so forth. We have our pharmacist that sits at that table and supports families for a wraparound service, really holistic. So they also do some of our education, our training that our staff are required to do for medication delivery. We have a pharmacist that oversees that curriculum and is part of our accreditation expectations that we have somebody credible and licensed to do that. So they've offered us really enhanced kinds of supports. Step up. They do things, they participate in our Sledge Hockey Day, which has been our fundraising over the years. They've sponsored other companies to put in teams just so that our Sledge Hockey Day will be, something that is positive and community focused. We've got other organizations like Service Credit Union that has been our banking that has worked really hard again, giving back. Or these companies have not only given back in maybe donations to the organization, but also in direct support or promotion of it. Allen and Associates, I see that go across, has been our auditors for quite a number of years. And again, we have negotiated rates that are probably better than most. And they just have a really strong ethical focus on giving back to community. So when you start building those kind of relationships, you get amazing, not only business products and services out of it, but really strong relationships. And they promote us, right? They've brought in other companies to help us with other need areas. So it's really important that we focus and work with our business community.
That's so good. So as a leader and someone who, can keep a group of sponsors together, a team together, serve clients, and in a way that is, every aspect of your business has lots of feeling attached to it. There's a lot of high connection, and been in the community here, working and serving for decades. And you can see the community. What could you share right now? We're at the peak, but now things are starting to open, but still there's isolation, there's routines, there's schedules, there's new things happening to people. What could you share that would, with our viewers and listeners, that would be helpful at this time?
If anything, it's the importance of staying connected. It's funny, we're more isolated, but in a lot of ways, I feel we're much more connected I think we communicate more efficiently, better, and the relationships I've had over the last 2 months with my own direct leadership team have been tenfold improved. I have never communicated to the level I have under this crisis, because you have to. I never appreciated how much I could literally be next door to somebody in an office with a wall between us and never see them an entire week at a time. And throughout this, I have spent 2 to 3 hours every day on Zoom with my leadership team. We have never been this connected. And for us all to work together and not in isolation of one another, because we get so busy doing our own thing and running our own departments. I think sometimes that ends up being the challenge, right? It's the not being connected, not understanding maybe the impact that one department has on another, whether it's a finance team or direct services. So we have really come together, and I think that's important. I also have had to communicate by far more with our direct service staff and our families and individuals. Now, again, that's been more through an email kind of process, but a question and answer. Our families have never had this much communication from us, whether it's been posted on social media or whether it's been through email. And I've had a lot of good feedback from it. So it's how am I going to maintain that is also the challenge, because when you get back into the working, how you used to work, maybe, those are really important messages and learnings for me, is that you always hear about what's the biggest concern people have about operations or a company. It always is communication. And it's been really apparent that it's been really critical as something that we need to continue to work towards, at least a portion of the standard we've come up to delivering it throughout this time.
And Marie LePan, CEO, Chief Executive Officer of the Robin Hood Association, with me, James Stein, who will TV you on the Community Channel. What a delightful visit. Such hope.
Thank you.
Community leader, community champion. Thank you so much.
Appreciate it, James. Thank you.
Yeah, we'll see you next time.
Okay, take care.